What's going on, everyone? Happy Tuesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Pandemic Update for Tuesday, May 21st, 2024. If you're new to my channel, this is where we do the daily pandemic update and also virus update. Why do I say virus update? Because there are a lot of different viruses out there that each can carry a health threat to you. We see viruses pop up at random. We're going to be talking about a few of them today. One that's actually local right here in my city that has once again reoccurred for the second time this year. So, yes, you want to stay informed. That's what we do here. We do a daily report of what's going on in the United States, and as of lately, we've been getting more data about what's going on around the world. As you can see, we're going to start off with New Zealand today. But before we get to that, if you're new here, subscribe down below. Give this a thumbs up. The more people that hit that thumbs up button, the more YouTube pushes this content out throughout our channel, and the more people will come and see our pandemic and virus updates. And of course, share this with anyone you know. The more people you share this with, the more people we can help keep informed of what is going around in the world of viruses. And if you have any comments, leave them down below. All right, let's start off today. First off, we're going to talk about New Zealand and then a whole bunch more data and news reports. We got news and data out of Australia. We have news out of Philadelphia that has to do with measles. Yeah, we got a lot of different things to talk about. So let's just get right into it. New Zealand COVID weekly update, May 13th to May 19th. New cases, 6,146. That is up by 56.7%. Reinfections, 3,916. That is looks to be a 63.72% of the cases. And deaths, they are up by 46.1%. That's 19 deaths. In the hospital, 242. That's now up by 59.2. So there's no denying in New Zealand. All levels have increased in this week's report, including the number of deaths. Now you may say, well, 19 deaths, it's not a lot. No, it's not, but in the beginning of the pandemic, New Zealand really took this serious. They had it down to like COVID zero. They weren't doing much in the way of cases, and I don't think they had their first death for quite some time. So, yes, New Zealand is rising. All right, this comes from X once again. I use X for a lot of things. It's a lot easier when people post charts, so I like to share what they posted. This comes from Mike Honey. It's Australian COVID statistics by geography, and you can see here on this chart there is clearly a significant rise in the 7-day case average. And taking a look at more stuff coming from Australia, COVID-19 outbreaks in Australian residential aged care facilities. This is as of May 16th, 2024. I guess that's where the data is as of Dennis, the COVID guy, tweeted this out last night. Active cases, well, it would have been morning there, nighttime here in the U.S. Active cases, 3,110. That's up by 560. Active outbreaks, 378. That's up by 83. Residents impacted, 2,150. That's up by 364. Staff infected and impacted. That's 960. That's up by 196. Reported deaths in 2024, 389. That's up by 40. Mind you, Australia is now entering fall and going into winter. They're going to be starting winter pretty soon. So basically, remember how we saw a winter surge here in the United States back in, late fall, late November, post-Thanksgiving through to about the first part of January? Well, now it's their turn over in Australia to see their winter wave. And they do see more than one wave a year, but right now they are seeing their winter wave. All right, moving on now to this. Taking a look at this, more Australia. Queensland, weekly infection surveillance reports from May 13th to May 19th. And it says COVID, 1,442 cases, that's up by 20.8%. Influenza, 657 cases, up by 13.6%. RSV, 1,154, that's up by 10.9%. Again, they're entering winter now. They're going to see their winter wave of COVID. But remember, COVID really doesn't care what season it is. There can be COVID waves at any time of the year, but Now it is the colder season, and that's when the biggest waves of COVID tend to occur. All right, speaking of COVID, something we have not said in a while. Remember how we have been tracking cases of illness in the MLB? Well, here's one. This is a little bit of a surprise. Ian Hamilton, who is a relief pitcher for the New York Yankees, was placed on the Yankees COVID injury list on Monday as he tested positive for COVID. And this was as of Monday, May 20th, 2024. He is currently 28 years old. In case you're wondering, what is the COVID injury list? Well, that's a list you get put on if you're in a confirmed case of COVID and you tested positive and you're an MLB player. Haven't heard the term COVID mentioned in the Major League Baseball at all this year, and there have been a lot of cases of illness going around in the MLB. There have been several teams impacted. As a matter of fact, I've lost count. There's some that we didn't even get to document on our site that I'm finding out that happened before I decided to start documenting, like early in the season. I was just told by someone the other day that the Reds had a lot of cases of illness. Now the Toronto Blue Jays, yeah, they may have up to 20 players that were sick at one point. Yeah, not good what's going on in the MLB, but hey, we do have one that is confirmed to be COVID. That's Ian Hamilton of the New York Yankees. All right, I said I had some local news in my area, and when I say local, this is Northeastville. I live in the northeast section of the city, so yeah, this touches home. This is not far away. Residents warned of possible measles exposure in Philadelphia and Montgomery County, and I know precisely where these exposures are. CVS Pharmacy on 10,901C Bustleton Avenue, that's up in the Northeast, and Holy Redeemer Hospital Emergency Department has had an exposure as well. This was on May 16th through Friday, May 17th. If you were in any of these areas, of course, you want to be aware that there was a possible exposure, as there is someone who is positive with measles. Hopefully this does not lead to more cases. We did see measles alert earlier in the year in the Delaware Valley, where there ended up being multiple cases of measles. All right, moving on to this now. Just a reminder on something we've touched on in the past. More than a quarter of people with COVID infection develop long COVID, new research reveals. And when I say new, just about under a month ago this was out. This was by the University of York. A new study carried out by researchers at the University of York said yes, 28% of people who catch COVID-19 will go on to suffer from long COVID. And this is basically referring to what's going on in the UK right now. But hey, it's valid research. With long COVID a key factor in the record, 2.8 million people off work in the UK due to long-term sickness. The researchers are calling for yearly COVID-19 vaccinations to be rolled out and should include all working-aged people. At some point, we are going to do a dedicated video on sickness, because I can tell you this, time and time again, when I'm out doing my deliveries, I go to pick up from somewhere, sorry, we're running a little bit behind, we got some people called out sick. It's the theme I hear at least 2, 3, 4 times a week. Oh, last week was totally ridiculous. At one point, there was a place, they were 45 minutes behind on dine-in people and carry-out deliveries because, oh, sorry, we have 4 people out today. Yeah, it was just total insanity. All right, moving on to the weekly BNO update, which I actually forgot about yesterday. I forgot to include it, but to my surprise, turns out BNO was a day late in putting it out. No worries, we're both even on this. I forgot, they were late. Okay, weekly U.S. COVID update. New cases, 36,333. That's an estimate. Mind you, this is very limited data, and they say that. Note, limited data. Average, 45,882 in the hospital. This is likely a huge undercount. We'll explain down below. In the hospital, 1,811. In the ICU, 203. New deaths, 459. The average is 525. Taking a look at this. This week, only 43% of hospitals in the U.S. submitted COVID data, a sharp decline from 91% last week. So this is not good. It could be even lower in the upcoming week because, remember, Memorial Day weekend's coming up pretty soon. And they state this makes it difficult to provide a clear update on actual case numbers and hospitalizations are higher than the actual report. Obviously, when you have a lot of hospitals not reporting, the real number is likely higher. Some states are reporting an uptick in cases for the second week in a row. Example, New York is 10% higher from the week before. New Jersey, wow, New Jersey is now 61% higher on cases. Because of limited data, it's too early to draw conclusions from this, they say. This is the 44th week in a row with more than 400 new COVID deaths in the U.S., or 58,430 deaths during the same period. All right, take a look at this. Finally, yes, they end on, so far this year, more than 3.2 million COVID cases have been reported in the U.S., causing 282,382 hospitalizations and 28,936 deaths. And in case you're wondering, yes, I do believe that is higher than what was seen with influenza so far this year. And we're only in May, pretty soon going to be in June. All right, taking a look at something else now, H5N1. Two things from H5. First off, Michigan reports 3 more H5N1 outbreaks in dairy herds. And in other developments, yeah, this is not good, H5N1 has been detected in cats from South Dakota with no known links to poultry or dairy herd outbreaks. So that's not good. Some news out of Wastewater Scan today. Remember, we had the bad news out of BioBot. Now we have some somewhat good news out of Wastewater Scan. Today we published this is them speaking here. Today we published a study sharing work from our team. We developed a test for and detected significant levels of H5 avian flu when analyzing samples from 4 wastewater plants in communities near H5N1 outbreaks. These spikes in H5 and flu A took place right before and during confirmed outbreaks of H5N1 among dairy cows at sites in Texas and North Carolina. With H5 detected in samples taken before outbreak identification in cattle, we did not detect H5 in Honolulu, Hawaii. That's a good thing. Here's the exciting part. Well, exciting if you are into keeping an eye on what's going on. We're actually going to gain a little bit of data here. Yes, I can't believe I'm saying that. Their wastewater scan program will start testing for H5 in all 190 sites this week, and data will be shared with local public health officials and on their dashboard, data.wastewaterscan.org, when available. As we all know, in the age of less data, wastewater is a critical public health tool that can help us tell the picture of what is going on with viruses, not only in the United States, but really around the world, at least in the countries that are still using wastewater, and we're lucky enough to still have wastewater data, knock on wood, here in the United States. Alright, moving on now to today's pollen outlook. 38% of the country is in medium status for pollen levels, and there are some areas that are in the red today, such as northern Oklahoma, portions of Kansas, Missouri, northern Arkansas, Ohio, western Pennsylvania, parts of New York, and parts of southern New England, including New Hampshire, Vermont, Massachusetts, even portions of Connecticut today are in the red. West Coast, yellows and orange. It's not terrible today. The upper plains, the upper Midwest, not too bad for you, and not too bad in Florida as well today. And the Pacific Northwest is not terrible, like Seattle, Portland, Oregon. You've had worse. Today is actually not a bad day for pollen for you. Taking a look at what is going on with air quality values today as we refresh this, let's see where we stand today. And you can see here, oh my, look at the oranges. So this area of bad air quality in the plains, we'll say the southern plains like Texas, Oklahoma, it's actually getting a bit worse now. There's much more orange showing up. Remember, there are wildfires that are ongoing in Mexico, so that is part of the problem. And this does continue up into Missouri. Even some orange is starting to show up in Iowa and portions of Illinois today, which that area also has a severe weather threat. We'll talk about that in just a moment. You can see here the Great Lakes up into the northeast. Yes, there is a scattering of yellow today, which means you're getting near some moderate levels. And down to the southeast, not terrible. Northern Georgia, northern Alabama, northern Mississippi, you do have some problems today. And on the west coast, we do have our typical hotspots right along the I-5 corridor in California. Take a look at the severe weather threat today. I have to keep you safe from severe weather as well, because already tornadoes have claimed some lives this year, and there is now a tornado watch that is up in portions of Iowa, up into portions of Minnesota and Wisconsin. So yes, this is serious because there is a moderate risk there today, and the tornado threat is a bit higher today than it has been yesterday. 15% chance of a tornado. Some of them could be strong and long-lived. There's wind potential, 45% hail potential. If you live in any of these areas right here, especially where this moderate risk is, please take all severe weather warnings serious today and tomorrow. Yes, look at this. Enhanced risk from Texas through Oklahoma, through portions of Arkansas and portions of Missouri, and a slight risk of severe weather all the way up into portions of western New York. So that is something you want to take seriously. Take a look at this. I have another platform where I do talk about what is going on with the weather. It is Climate Data Report. You can find that on X. Here's the handle right here. You can pause the video. You can literally put that into the search bar of X and you can find it. Taking a look at Philadelphia EMS calls for Monday, and it's not good. It was 847 EMS incidents, and mind you, we are dealing with some heat today. It's up to 86 degrees. That's not terribly warm, but we're starting to get warmer, and you saw the air quality values are starting to get a little unhealthy. So therefore, I think we're going to probably remain at elevated EMS levels this week. I'd be surprised if we don't, because the last time we had a warm up just a few weeks ago, each of those days did have high EMS calls. Let's do a live look in at Montgomery County, and we see there's actively 16 calls right now, just a scattering of different calls. We see vomiting several times, respiratory emergencies, general weakness, stroke, whole bunch of different things, cardiac emergencies, dizziness, a lot of different things going on right now. Taking a look at what's going on in Chester County, Pennsylvania. Wow, a lot of calls. Let's count how many calls. 1 call, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. I mean, that's catching up to Montgomery County levels. And usually Montgomery County, when it gets super, super busy, the busy time of years, it's usually a higher number than what you would see in Chester County. Very rare would Chester County ever have a day where it's much higher than Montgomery County, but today they're just equally as busy. I mean, we do have days where they're close to being equally as busy, and today is one of them. And you can see there's a lot of different types of calls. Walgreens this week. We're not going to take a look at any individual states today. National positivity trend is 17.5%. The prior week was 15.3%. Difference of 2.2% up. Total test 3,697. The prior week was 3,565. So you can see it is going up slightly. It's not a massive increase, but again, testing is also not that high as well. All right, quickly taking a look at some CDC data. Let's take a look at the latest variant of COVID, and that's the KP.2 variant at 28.2% of the cases. JN.1 is at 15.7% of the cases. All right, we're not going to look at any wastewater sites today. We spent a lot of time on that news and international data, but we are going to take a look at some data here in the United States. New Jersey hospitalizations. You just heard BNO. They announced that New Jersey cases are up. And not all their hospitals are reporting. 65 out of 70, and that still results in 172 hospitalizations and 9 people on a ventilator at this time. In the ICU, 21 people in the ICU. Discharges, 21 at this time. And I do think it is safe to say that in the state of New Jersey, I think we can expect to see somewhat of an increase in hospitalizations going forward. I suspect at some point, maybe over the next week or two, they may find themselves at or just above 200 hospitalizations once again. And of course, if it starts going up higher than that, then we have to get a little bit concerned. I mean, it's not a lot of hospitalizations, but a rise is a rise, and it indicates a rise in cases. And when cases go up, your chance of getting a case or even going on to develop long COVID from a case do increase slightly. All right, New York State, 460 new cases. That's lower than the number reported yesterday. A number that's not lower is hospitalizations in New York State. Yesterday they had 448, and the ICU number was 41. That was finishing off last week. Let's go over to the new week. In the new week, they have 490 people in the hospital. That is an increase, a good size increase. And in the ICU, it is 52. So there was a sizable increase. Again, you were going from 448 people hospitalized to 490. That equals, let's see, 42 people more in the hospital now, and we'll have to see. It's possible that number could go back over 500 again this week. I don't expect it's going to end up being a massive increase, at least I sure hope not, but right now they are seeing a bump in the road, and we'll have to see. Only time will tell. Will this lead to something more? Historically, we don't usually see a big wave from Memorial Day weekend, but given we're entering a new variant, we'll just have to see what happens. And plus, given there are a lot of different countries right now around the world: Singapore, Australia, New Zealand, where else? Spain, France, the UK. They are all seeing rises right now. We have not followed what happens in the UK in quite some time. It doesn't mean at some point in time we could not go back to doing that once again. We'll just have to wait and see. Alrighty, folks, that does it for today's pandemic update. I know, it was a long one. We crammed a lot of stuff in here today. We've gone over 20 minutes, which I kind of do not like to do, but it is what it is. If you learned anything, give this video a thumbs up. Want to see more content like this? Subscribe down below. And of course, share these videos with anyone you know. Leave your comments down below. And another reminder, I am still looking for a moderator for the comments section of these videos because, quite frankly, it's gotten too much for me to keep up with all the comments. Yesterday, the video that got viewed big time, and comments kept coming in, and I couldn't keep up with them all. I enjoy reading your comments, but sometimes I just cannot keep up with all of them, so we definitely need to find a moderator to help out with that. Alrighty, thanks for watching. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching.